Hi there, folks. This is Dr. Ellenburg with a medical show here on Fox News Talk 1020 AM, 95.5 FM. Also find us online at foxnewskoan.com. That's foxnewskoan.com. Check us out live streaming on the web as well. Of course, it's a medical show. Questions about your health, questions about our topics, those are encouraged as well. Our phone number here is 522-1020. It's 522-1020. And some reminders, too, you'll find me during the week at the Ellenburg Center for Natural Medicine. Our phone number is 563-2366. That's 563-2366. You can learn more about our services at the Ellenburg Center for Natural Medicine by visiting our website at drellenburg.com, and that's Ellenburg, ELLENBURG.com. Check us out. Again, our services are on that site, as well as archive radio shows. We do have a suggested website review on our site as well. Learn more about your health, things in the environment that do affect your health. And we do have suggested reading materials, learn more about therapies that we offer and others that offer as well. So again, drellenburg.com or .net, either one works. And during each month, I do attend and see patients in Kenai and the Palmer areas for times and dates in Kenai, or .net for that matter, or Palmer. Our office phone number is 563-2366. Okay, well, snow has finally made it to this part of Alaska, it seems, which is a good thing. So just encourage everybody out there to be careful when you're driving and pay attention to what you're doing. It's time of the year many people get in accidents, and the last thing you want to have is a sore neck or a sore back for the holidays. So please be careful out there and wear your seatbelt. In today's show, what's the topics? Well, as usual, we'll have a few things talking about cancer. We're talking about vitamin D and a new way to be using that to possibly prevent cavities. We're going to talk about alkaline foods today, talk about some pollution that was measured very, very high in North Pole, Alaska area last week, and an interesting article discussing how pesticides may be increasing our risk of allergies. And today we're going to focus also on talking about inflammatory bowel disease. That means things like Crohn's disease and ulcerative colitis, and what are some common problems in those patients besides the fact they have a gastrointestinal problem, which is a huge one, to say the least. And we will also be talking about thyroid measurement, and a very interesting study came out talking about what's the best time of the day to have a thyroid test done. And in the last few weeks, you sure no doubt have ran across an article, if you're interested in medicine or watch the news or anything, talking about how mammograms may not be good for you. There's a recent study that came out talking about ultrasounds along with mammograms or by themselves as possibly being a viable screening option for those concerned about getting breast cancer. So we'll get into that as well. In fact, let's just start right off the bat with that one, since we'll hit our mark on cancer. As I mentioned a few weeks ago, since I have a huge interest in seeing cancer patients, we're going to be talking and often about, and since cancer is so common these days, unfortunately, each week having a little bit on talking about cancer and something related to that. In this case, mammograms. So there was an article that came out just a few weeks ago that was entitled, 1 million women overdiagnosed with breast cancer with mammograms. And actually, I believe last week we even discussed this same article. That, first of all, what I'm going to say next is I'm not saying don't get mammograms. Okay, I'm not saying that. What we are talking about is, using them appropriately, being aware of the ins and outs with them, and realizing that we actually are finding some tumors these days with the current technology, including breast MRIs and even mammograms, that may have never been a problem for a lot of women in the first place. And where do you draw the line on treating somebody when you find cancer in them? And it would be malpractice to not treat somebody who had cancer, or suggest get treatment at least somewhere for their breast cancer. But the study that came out was presented at the long name here, the Radiological Society of North America's 98th Scientific Assembly and Annual Meeting. So radiology meeting took place, I'm not sure exactly where, but a presentation was put on talking about, so her name was Dr. Berg, was her name, for the American College of Radiology Imaging Network. We're looking at some comparisons between mammograms and between using ultrasound. Now, I guess the question we should actually answer to is, what's the difference, in case you don't know, and most of us don't know what those two things are differently. So a mammogram is going to use radiation to image breast tissue, to look inside to see if they can find anything that looks odd or abnormal, where an ultrasound is going to use sound waves to, again, look for abnormal tissue density type things in the breast, cysts and such. So being used for some similar things to screen for breast cancer, but different technology being used. There is no radiation from ultrasounds. Again, no radiation from ultrasounds. Okay, important to understand that. So in this particular article, I looked at, again, the combination of that, and I looked at some data that ran in a study, had a real long name. What was that one? The Akron study here several years ago, looking at the usefulness of an ultrasound alone in detecting breast cancer. And the one thing about ultrasound does have one thing that's important is that it's more portable, and you don't need as much of a, so to speak, an infrastructure that actually contains it. I mean, we do have mobile mammogram units, but if you think about even outside of Alaska and the world in general, what's easier to be doing things? And needle biopsies are easy to perform on women and men both who can get breast cancer, by the way. Men can as well, if you see abnormalities on an ultrasound. So it can be used to do that. It's a useful tool where you don't have to have a mammogram-assisted needle biopsy to sample some tissue and someone who might look abnormal and get it tested. And in a particular study, 3 yearly rounds of screening that were done, and with mammogram plus an independent physician-performed exam along with interpretation as well of a whole breast ultrasound. And in this particular study, participants had either a biopsy or a 12-month clinical follow-up in the 4th year if they didn't have anything abnormal. And what we found out from the study is that the analysis showed that about 110 women were diagnosed with 111 breast cancers, and of these cancers, 89 were invasive, which is a big deal to find. Those tend to be more troublesome to treat. And the two methods together, ultrasound detected, 53% of cancers, and mammogram detected the same amount. So they actually tied in this particular study. And importantly, too, is that the discussion in talking about what type of breast cancers can be found, the more invasive a breast cancer is, typically tends to be more aggressive and harder to treat as well. And so ultrasounds did quite well in comparison with mammograms in finding those type of invasive cancers. So it's nice to be knowing this. Now the question is, are we going to have more ultrasounds done than mammograms? At this point in time in this country, I doubt that. And I'm not a radiologist. I'm just presenting the information here, in that there are other ways of doing this, and there are in certain countries where they don't have a mammogram around, they use an ultrasound to screen women for breast cancer, and it does work. The hardest part, typically, that I've found with patients is that if a patient really is adamant against a mammogram, it can be extremely hard in Alaska, as far as my experience is, of getting a ultrasound done on your breast if you haven't had a mammogram done. It's very hard to get that done, with that said. But at the same time, it is important to realize there are other ways of screening for breast cancer besides mammograms, and one of those, even based on this article, would be an ultrasound. So consider that as one of those possibilities. And there is our cancer topic of the day. All right, let's discuss a little bit about vitamin D. We hadn't talked about vitamin D in a while. Again, some reminders, if you do have questions about your health, questions about our topics here, your calls are encouraged. As always, I have plenty to discuss on my own here with our topics. However, I'm always open to having phone calls about questions of medicine. It's a live call-in show. You're encouraged to call. So our phone number again here is 522-1020. It's 522-1020. Good old water there. Okay. So vitamin D. And again, it's worth reminding people out there, as Alaskans, we don't get a whole lot of vitamin D from the sun. I know if you're a regular listener, you probably heard saying this, probably heard it 20 times. However, in Alaska, pretty much from the middle of April, first part of May until the end of September is when you actually get vitamin D from the sun. You're out in the sun, you would get vitamin D made in your skin. Depending on how long you're out in the sun. Some more than others, depending on how long you're out in the sun. Getting vitamin D production made in your skin because ultraviolet B, UVB rays from the sun, stimulate and begin vitamin D production in your body by first hitting your skin, and then goes on a long pathway from there to make vitamin D in your system. But that's how it starts. So in the winter, we get none. Zilch, zero, nada. So all those great weeks we had of clear sunshine and cold weather, even if you were outside in your face and were doing things outdoors, you were getting no vitamin D from the sun. Okay, very clear about that. So therefore, it's important to be on a good level of vitamin D in the winter. And what does a good level mean? That means, what is your blood measurement? And as always, if you're curious about taking vitamin D and how much to take, it's smarter to actually get a blood test done, have it interpreted by your provider, and have them suggest a daily dose to be taken, because the daily dose, or RDA, which is a joke, is so you don't get rickets or a bone disease, right? That's what it's there for. But in a recent study that appeared in the Journal of Nutrition Reviews, is talking about looking at the use of vitamin D supplementation to reduce the risk of developing what's called dental caries, which are cavities. And this article, first off, top of the bat, said vitamin D supplements were associated with approximately a 50% reduction in the risk for dental caries or cavities, according to a new review or meta-analysis that was done online, published online, And meta-analysis means it took a whole bunch of studies, put them together, went through the data and said, hey, listen, vitamin D makes some sense in reducing dental caries, in this case, that means dental cavities in patients. And why does this make a lot of sense? Well, for one, and we've never had this topic here on the show, Ryan talked about it, but vitamin D actually does have a role that's been known for a long time, actually in tooth formation. And so even in children who are have growing teeth, and typically by the age, I'm not a dentist, but my dad was, and I want to say he said that by the age of like 7 or 8, even the your adult teeth have, in a sense, been formed. Of course, they haven't erupted; they're all underneath the baby teeth that are there that haven't come out yet, but they're there. And so formation is important at that point in time, based on the amount of fluoride somebody has in their body, based on the vitamin D content of foods or availability of the sun, or what mom had on board, because a lot of vitamin D does come out of mom to their child when the child's in them gestating and growing when they're a fetus. And so, again, a reminder, too, a lot of women who are just had children, a lot of times their vitamin D goes way down and needs to be replenished. And certainly an issue here in Alaska. But vitamin D plays this very critical role in tooth formation, but also may play a role in actually preventing further cavities even after the child is older and into adult. And that would be most likely, we think, through its ability to modulate certain parts of our immune system, and also through an antimicrobial effect. And antimicrobial means things like viruses, bacteria, and funguses. That's microbial, means a broad spectrum type of a thing, where vitamin D might have a hand in that. Just like we talk about here on the show frequently about using vitamin D for colds and for flus, even while you have them, or try and prevent even getting them in the first place. And a lot of research actually was done in this area between the early 1900s and the 1940s, suggesting that supplements and even UV light treatments could reduce dental cavity rates. Very interesting. In those earlier studies, most of that was ineffective after the age of 13, although most of the studies weren't done afterwards. And there's been 2 studies published in a 75 to 89 period of time. And so most of the data is a little bit older, but doesn't make a big difference, because the reality is we're probably getting more fortified vitamin D foods today, things like milk and butter and such, where getting vitamin D from your food really is kind of tough. You get minor amounts from your food. In reality, you need a lot more from supplementation and exposure to the sun. So consider that if you have children who are getting a fair amount of cavities, if it can't be figured out from the food that they're eating, for example, and their dental hygiene in this case, as far as brushing their teeth and flossing, you may want to consider looking at vitamin D as being part of the issue and have them tested to see what levels are actually at, to see what kind of dose they should be taking in the first place, versus just kind of guessing and giving them vitamin D. May need a lot more than you're actually giving them. Happens a lot, actually, that we see that in people, mostly in adults, because most of my population versus children, but that's how we're kind of seeing it. All right, so there's our piece on vitamin D. We have one of those in a little while, so check that out. Again, that appeared in the Journal of Nutrition Reviews. Again, folks, it's Dr. Michael Ellenburg. It's a medical show here on Fox News Talk, 1020 AM, 95.5 FM. A live stream on both those stations. If you want to find us online, we're at foxnewskoan.com. That's foxnewskoan.com. You can live stream us on your computer. And if you have questions about your health, questions about our show, or questions about vitamin D for that matter, our number here is 522-1020. It's 522-1020. All right, well, let's talk a little bit about thyroid disease here. Again, one of my favorite topics to discuss, and a very great article that appeared from our association, the American Association of Naturopathic Physicians, is AANP. It's a national organization, and they have an article written by Dr. Kazor that was reviewing an article that appeared in the Endocrinology Research in August of this year, talking about what is the best time of the day to have your thyroid levels checked. And anybody out there listening to the show today who doesn't have a thyroid problem, you can probably ignore this piece. But if you do have a thyroid problem, or on top of that, if you think you have a thyroid problem, it actually might be very important as to what time of the day you're actually having your thyroid levels checked via your blood. In this particular article, again, that appeared in the Endocrinology Research Journal, looked at having the blood drawn for a thyroid hormone level, in this case, looking at TSH, thyroid stimulating hormone, which comes from the pituitary gland in your brain and tells your thyroid gland to make thyroid hormone. So it's a common screen done by many providers for years. And looked at having the test done in the morning between 8 and 9 a.m., and then having it done between 2 p.m. and 4 p.m. And what we saw here is that as the day wore on, people's levels of TSH tended to be, in this case, higher. How does this work out in the morning? TSH levels were lower in the afternoon compared to morning values, okay? And so that means if you had the TSH done later in the day, it's not really giving you the best measurement of that thyroid test for TSH. And there were people here in this same study who were also taking medication, in this case Synthroid, and the same thing was correct as well, where their morning measurements were higher than their afternoon measurements. Why is that important? Because we use TSH clinically as providers. If we're using thyroid hormone, for example, or using any type of nutrient support, things like selenium or tyrosine, for example, or zinc, or iodine, for that matter, a very important one for thyroid function, we want to get a good idea about where their TSH levels are really at. And so doing it later in the day is really a problem. And the other problem we addressed on this show several times, and it's worth saying this again, is the range for that measurement. Even 13 years ago when I was in naturopath medical school, we talked about, not even we, the American Academy of Endocrinology, discussed lowering the reference range. That means the value where the TSH falls in from a higher to a lower range, which would have included a lot more patients as being having hypothyroidism because a TSH would be elevated, which is a strange thing about thyroid disease is you have hypothyroidism if your TSH is high, not low. If your TSH is low, you would have hyperthyroidism, okay? And we're talking about low thyroid function, hypothyroidism. And the range is just now starting to change with some labs, where the old range is 0.4 to 4.0, the new range 0.4 to 2.5. And that would include a lot of people who are not being included as far as having thyroid disease. And that's really, really important. And furthermore, if you're seeing your provider and you just started taking thyroid hormone, and you go back in for a test, 8 weeks later, for example, or 6 weeks later for a test, and this time you happen to do it in the afternoon versus the morning, you're going to have a different result. So I guess one thing to point out is to make sure is that if you are having thyroid tests done, at least have them at the same time you have them done, but better yet, you have them done in the morning. And what we encourage patients to do too, which is a little bit different, but not different from a lot of other providers, is that they don't take the thyroid hormone the morning they get their test done. They take it right afterwards, in the morning, because if they take their medication in the morning and come into the office, say 2 hours later, their levels are going to be fairly low because it's just taking the thyroid hormone. Or if it's taken later afterwards, we get a better idea what really is their TSH at as time goes on. So, and it's probably more than you folks that actually want to hear about this, but the reminder is, if you do have thyroid disease, make sure you get your levels of thyroid measurement done in the morning, not in the afternoon, okay? Have thyroid level tests done in the morning, not in the afternoon. That's the big takeaway from that one. We've got about 3 minutes before the bottom of the hour break here. Let's have a little discussion quickly here about an article that appeared. I get a lot of information on environmental things out in the environment that affect our health, and certainly pollution is one of those things, but the article, I think it first appeared in the Daily Miner, which of course is the Fairbanks newspaper, but that particulate pollution. So what does particulate mean? What is that? Particulate matter, PMs as are for short. So particulate matter are basically things that are coming out of our cars, okay? Carbon monoxide, we're talking about diesel, for example, puts a lot of these compounds in the air. And so the particulate pollution level in North Pole on November 27th, was the highest out of any of the cities that are measured in the lower 48. Interesting. First of all, well, why is that? And if you want to read more about this particular information, you can go to airnow.gov, AIRNOW.gov, and it will list particulate level pollution information for different cities across the U.S., including North Pole, Alaska. And at North Pole at 7 a.m., the matter was 204 micrograms. And it was 245 later on Tuesday that day at North Pole Elementary School, and reduced by the time in the morning. So traffic is going to put out a lot of stuff into the air. You're going to breathe it, and as you've known, up until very recently, which in the last 2 days, it's been cold everywhere. And that cold air will hold down that particulate matter and kind of keep it over there and really create a high smog type thing. So, frequently we'll even hear from patients in the Anchorage area on really cold days coming, man, I'm having trouble breathing today. That's the air outside you're breathing. So if you end up being a patient who does have trouble or has even, for example, multiple chemical sensitivity, it would be important to actually kind of pay attention to air quality measurements frequently. And I'm sure that I haven't actually had a chance to review the airnow.gov site, but I want to say for sure Anchorage is probably on there. And you can check it out. Like today, it'd be low in Anchorage area, where like last week it would have been higher because of the inversion that takes place with cold air holding down this pollution right in the city area. And in a lot of places where you've had a lot of, and why is this stuff bad for you? What's it really do? Well, the EPA's got a nice statement on it. So the size of the particles is linked to how they actually cause health problems. In particulate matter, tends to be very, very small. And it's a measurement called micrometers in diameter, extremely small. So anything below like 10 micrometers poses a great risk because it can go very deep into your lung tissue and even possibly into your bloodstream. And they've done measurement for years on people, especially in high volume areas of traffic, like for example in California, who live near even people who live near highways, who live there but not actually in their cars, but live near the highways, as having high exposure to particulate matter or PMs. In this case. Throughout the year because it lived next to the highway, for example. I did give an article here on the radio, I want to say about a year and a half ago, my best guess, that was talking about people who heat with wood in their homes. And for you out there, there may not be many of you, but maybe you may have homes in different parts of Alaska where you use wood heat as your main fuel source. And woods itself, if you don't have a very, a tight fireplace in a sense, or a wood stove that would leak out a little bit of smoke, you may have a fair amount of particulate matter in your home. And in one particular study, they used high efficient air purifiers in people who had wood stoves in their homes. Prior to starting this, they actually tested them for inflammatory markers and found out that when they used the air filters, they had less inflammation in their bodies overall. So, got to watch out for that. All right, folks, it's time for the bottom of the hour break. We're back here in a few minutes.
Another runner in the night, blinded by the lights. Wrapped up like a douche, another runner in the night, blinded by the lights. Wrapped up like a douche. Madman drugs.
Hi there, folks. This is Dr. Ellenburg. Welcome to our medical show here on Fox News Talk 1020 AM, 95.5 FM. We're also online at foxnewskon.com. Questions about your health, questions about medicine. It's a live call-in show. You are encouraged to call. That is 522-1020. All right, well, I had time there to look online here in between the break and looking at the airnow.gov website. They don't have anything directly on there to go right to for Anchorage other than through the Anchorage Environmental Services Air Quality Program. And there's actually a phone number. My iPad here is harassing me as far as trying to get it for Anchorage. I was able to find out Wasilla is out of 14. Let's give you a general idea. We were talking about before the break there, pollution levels, in this case particulate matter, or PMs, measured in the air last week or 2 weeks ago, I think, a week and a half ago, in North Pole Fairbanks was 204, which is bad, very bad. So an important part of that, too, is getting an idea when you're looking at air quality for children that have asthma and those sort of things. It's important for you to to know when you are having bad days of air quality, you can actually call online. I found it right here. Air quality hotline for Anchorage is 343-4899. It's 343-4899. And you can also find out on that sign real-time air quality counts. And you can also, if you go, this is not a bad idea. When I lived in Atlanta for 7 years going to undergrad and for grad school, pollen counts down there were horrible. And I actually had the number memorized back in the day, but you can also get the pollen count measurements from the Environmental Services site of the Muni for Anchorage. So there's muni.org, and then go to Environmental Services site, and you can find out pollen counts, and that may be a big deal if you have allergies real bad in the spring. It's nice in the spring, meaning like, of course, Mayish. It's good to know where pollen counts are out that day to see how you're feeling, or if you're having a hard time, is it from the air that I'm breathing? Not a bad idea to know these sort of things if you have sort of troubles, and I've had troubles in my life over the years for sure, mostly with pollen versus outdoor air quality. So worth knowing those things. All right, let's get back to the rest of the show today. And for the next 30 minutes here or so, we're going to be talking about, again, some alkaline foods that are good for your body, and we're talking also about what are some vitamins and nutrients that are quite deficient commonly in people who have Crohn's disease or ulcerative colitis. And a lot of these nutrients actually can be commonly deficient in other people who don't have inflammatory bowel disease like Crohn's disease or ulcerative colitis. But there's a good article that appeared in naturalnews.com. Check them out. They have a lot of interesting information that they post on their site daily. You can even get a newsletter from them. It comes in your mail. It's free. And this article appeared talking about the top 6 alkaline foods that are good for your health. And one thing we understand about eating foods that make you alkaline is to remind people again, what is acid alkaline? What does that really mean? Well, the pH scale is how you measure the amount of hydrogen ions in a substance. That's how you find out pH. And so a pH starts at 1 and goes to 14. 1 to 6 is acidic. 1 would be extremely acidic. 6 would be moderately acidic. 7 is neutral. And then basically 8 to 14 is alkaline, with 8 being alkaline and 14 being extremely alkaline. Okay? And when we talk about eating foods to change our body's alkalinity, we're not going to change it a dramatic amount other than the fact of how we're going to change our acidic or alkaline urine. And that's one of the best ways to measure it. In your blood, you have a very, very narrow pH. It's like 7.3 to 7.45. It's a very, very narrow range that will not shift much at all. When we talk about eating foods and making the body more alkaline, we can talk about doing that from a standpoint of measuring urinary pH. And you can buy urinary pH test strips at a health food store and check yourself in the mornings if you literally got pee on it, and you see how it looks on a test strip. And if it's green, you're alkaline. If you're orange, you're acidic. Fairly simple. But you can eat foods that can change that, because your urinary pH can change anywhere from 5 to even up to 9 as far as the pH is concerned. So it's got a big range of how it can go. And we have discussed before here on the show about getting people's bodies more alkaline and having less inflammation. I've seen it happen in patients. It's happened frequently. So and a lot of times in joint disorders and like arthritis or rheumatoid arthritis, people get their body more alkaline. They tend to have less inflammation and less pain. Seen it. Just from food. Pretty amazing. So in talking about what foods to be eating, that's where it's not always clear. And, not every vegetable is going to make you alkaline. And I always recommend that people, we have a sheet at our office we took offline from Dr. Russell Jaffe that was created several years ago. It's still a good sheet. But if you put in acid alkaline diets online, you'll find a whole bunch of sites. And most of them are fairly accurate as far as, some are a little bit inaccurate, but you can find some good ones. And it's not always intuitive. For example, like eating lemons, even though they are acidic, they actually help your body create an alkaline environment by eating lemons. So in this case, put it in your water, for example, or even on your food. But what are some good examples of some vegetables, for example, that have a lot of alkaline properties to them? And a lot of them tend to be kind of like root vegetables, for example, things like beets, carrots, turnips, for example. Have a fair amount of alkalinity in them based on their mineral content. The cruciferous family, such as broccoli or cabbage or cauliflower or Brussels sprouts, also can have a fair amount, make it fairly alkaline, and are very good for your liver, the cruciferous vegetables in general. Leafy greens Always an interesting topic to say leafy greens. I don't mean lettuce. Lettuce, for the most part, does not have a high amount of nutritional value. We're talking about things that are like kale, for example, or Swiss chard, or bok choy, or spinach, or collard greens, or mustard greens, or even turnip greens for that matter, or things like parsley. Those things are, well, parsley I wouldn't call leafy green, but it's still very good for making alkaline in the body, and also for very good for your liver, by the way. And so are all the ones mentioned for your liver: spinach, turnip greens, Swiss chards, kale, collard greens, mustard greens. Very good for your liver overall, and also extremely good for making a more alkaline environment in your body. One food I haven't thought much about as being alkaline actually is garlic, which I didn't really think about to be the case. Garlic's a phenomenal vegetable in this case for your immune system. It's important for gastrointestinal health. It's very good for cardiovascular disease overall. It's a good cleanser of the liver. So a lot of good things to it, but also quite alkaline. And these folks in this particular article also mentioned lemons as one of those as well. But again, what I'd recommend is getting a list of foods that are acid alkaline and just seeing where you're starting from. I tell patients, get a highlighter out and on the acid alkaline food chart and highlight what you are eating that's alkaline or what's acidic, and see if your balance is off. And better yet, buy some urinary pH test strips, and you can test your urine. It's not that hard to do. It's real simple. It's actually can be effective for boosting your longevity, decreasing inflammation in your body, makes you more healthy long term. And a lot of us are running acidic on a regular basis. And for example, like soda pop makes you extremely acidic. Most alcohol makes you acidic. Most coffee makes you acidic. So water usually does not, except that with water, you want to make sure that if you're, using, for example, a reverse osmosis filter system at your home, what that's going to do is going to make your water actually a little bit acidic because it takes all the minerals out of the water and therefore changes the pH of the water to a more acidic nature versus an alkaline nature. So please be aware of that. A lot of people don't know that and think they're doing a great thing by doing reverse osmosis and taking out fluoride, taking out chlorine, and the other disinfectants that are used in our water systems if you're on city water, for example. But at the same time as they're making water that long-term will make them more acidic, which is not good for your health either. So please remember, if you have reverse osmosis, you can change that by getting some trace mineral drops and add those into your water after it's been treated by your sink or however you have it set up in your home. So consider that. And again, acid alkaline foods, you can find it online. You type in acid alkaline diet. Also, you can put a plus sign with that and put in Dr. Russell Jaffe, Jaffe is his last name, and you will find his particular image as far as his acid alkaline diet that he created many years ago, actually, I think, at this point in time. So check it out. All right, folks, this is Dr. Michael Ellenburg. You're listening to our medical show here on Fox News Talk 1020 AM. Also find us on FM at 95.5. And you'll find us online at foxnewskoan.com. That's foxnewskoan.com. Okay, well, let's discuss today something that people don't tend to think about. And I'm going to include in this group, too, anybody who's had gastric bypass, right? And we're talking about people typically who have inflammatory bowel disease, as also classic Crohn's. So that's one group. But next to this group, I also want to add in gastric bypass patients, because all three of these groups of patients have nutrient issues with their gastrointestinal tract and how much actually gets absorbed from their food. And it's important to realize that we can develop, if you have these conditions, you can develop a deficiency of nutrients such as vitamins and minerals or even trace elements. And it becomes to be a long-term issue. And why is that? Well, a lot of people who have, if you have a compromised gastrointestinal layer inside your GI tract, you're not going to absorb things like you should be in the first place. And if you have really bad Crohn's or also have colitis at times and have a lot of episodes, you actually have quite a bit of diarrhea that can happen, and you're going to lose a lot of nutrients that should be absorbed coming out with loose stools than if you didn't have that condition. So it's important to realize that as well. And then you also have people who've had surgery and had certain parts of their colon removed or certain parts of the small intestine removed, and that is going to change how they absorb certain types of foods. And even certain drugs that are used for inflammatory bowel disease, such as sulfasalazine or ASA type drugs, can also interfere with micronutrient absorption in your gastrointestinal tract as well. And what kind of conditions can develop from this? Well, we can see disease conditions can develop from having inflammatory bowel disease or gastric bypass, things like anemia, things like osteoporosis, Wound healing can be compromised. You can increase your risk for colorectal cancer due to having these type of disease conditions. We mentioned anemia. So anemia in the body can be caused typically from 3 nutrients. Usually it's either iron, B12, or folate deficiency. And folate and B12 usually go hand in hand as far as how they affect the blood, where iron looks differently on a blood test as far as how you cause anemia. But all 3 of those nutrients both support and help maintain healthy red blood cell production along with hemoglobin, which carries oxygen in your body. And so if you're deficient in hemoglobin or deficient in red blood cells, you have less oxygen in your body being carried around, and you can feel tired. So anemia tends to have this, people who have fatigue as being a very presenting sign and symptom that can be seen. Again, we're talking about people who might have or have had or do have, inflammatory bowel disease like Crohn's or ulcerative colitis. In this case, I'm also going to include gastric bypass. No, that's not inflammatory bowel disease. That's a surgery that's done that changes the way you absorb things, and your stomach is heavily involved in this. A lot of people have a stomach almost taken out or even shrunk down to a certain size, or even lap banded, for example, or a Nissan procedure is another one they can do. That's going to affect how you absorb your nutrients from your food. So anemia can be a problem in that group. And like I said, there are also medications that people can be taking for inflammatory bowel disease that can also decrease your absorptions of B12, iron, or folate. Other major important area, too, is how your bones are metabolized and how they're working in the body. And so many people who have trouble with inflammatory bowel disease or gastric bypass are not absorbing enough magnesium or potassium or calcium or other trace elements that are found in your bones for proper bone health. And so that can become a major issue in a lot of patients as well. We also can see an increase in the colon being inflamed, and an inflamed colon long-term can increase your risk of colon cancer, which you don't want to get. And so it's important to realize you could have something like that, and how do you keep it in check? Well, again, keeping good vitamin status on board, good minerals as well. In this case, also vitamin D. And a lot of patients who have Crohn's disease or also colitis or have had gastric bypass can have trouble absorbing proper amounts of their fat-soluble vitamins like A, D, E, and K. And so it's important to realize that as well, that a lot of us can have a fat-soluble vitamin deficiencies if we have long-term disease with our gastrointestinal tracts. And it's, again, important to have those checked, and vitamin D tests can be done very easily, as a matter of fact. Very easily. How common are some of these things? So the anemia present in patients with inflammatory bowel disease specifically can be as common as 90% to 40%, be quite common. B12 deficiency can be somewhere upwards of 30% in these patients. And I would say B12 deficiency is common a lot more in the population than we think it is, because, again, we have a lab test being done for B12 that's not always that accurate. And furthermore, the range for the B12 test is so large, from like 200 to 1,100. I really think we should be increasing the lower range to like 500, 600, and we probably have a lot more people being put on either some type of effective B12 supplementation or getting B12 injections, which can skip the whole process of how you digest your food, in this case, and give you a B12 shot, which can be very, very helpful for a lot of conditions, especially asthmatics, for example. And magnesium deficiency has been reported in inflammatory bowel disease as common as 90% in some patients. And I talk on the show a lot about magnesium because magnesium is involved in so many different aspects of your health. We do know that in the body it's involved in 300 different reactions. Magnesium is. That's a lot of reactions in your body. And many people, even those without inflammatory bowel disease, chronically are not getting enough magnesium and having other health problems, such as high blood pressure or atrial fibrillation. Article last week talked here on the show about atrial fibrillation and magnesium levels in the body. Or they get chronic cramps in their legs, for example. That's like almost a pathognomonic sign for a B12 deficiency in the body. Not always. It can be potassium too, but a lot of times once magnesium deficiency is corrected, they're fine. Constipation can be another symptom of being low in magnesium because it affects how your bowels move. Low energy magnesium deficiency as well, not just anemia. So it's a big deal of magnesium, but again, it can be even a bigger deal in these patients who have inflammatory bowel disease like Crohn's, ulcerative colitis, or have had gastric bypass. Those are some of the really big ones that come from this. And we say micronutrients, things like trace minerals tend to be lower in a lot of these patients too. And you can actually get trace mineral drops or even supplements at a variety of places. Mostly health food stores sells them too. to get you, and they're trace amounts, not high levels, because your body doesn't need giant levels of this. It needs trace amounts over a longer period of time to maintain these. And a great way to look at trace mineral status can be done what's called hair tissue mineral analysis, where you actually do a hair sample. It can be helpful looking at some of these things, along with some blood testing to kind of ferret out what's going on now inside you and what's going on before with your hair, for example. So that can be quite helpful in looking at some of these trace elements in patients. But it's again a reminder out there, if you do have inflammatory bowel disease like Crohn's or ulcerative colitis or IBS, or you've had gastric bypass, you need to be very vigilant about taking a high-quality supplement that will be absorbed in your body with a compromised gastrointestinal, the system. It's compromised compared to somebody else, and it's going to be important for you to be on, these things long-term to avoid these type of deficiencies that can develop over the lifetime of your health. So, highly, highly consider that. All right, folks, we've got about 7 minutes left in today's show. If you got questions, now's a great time to call. 522-1020. It's 522-1020. And while I wait for a phone call here, we will look at one of the last sections here we didn't get to today, and that's talking about an article. Actually, two things here we can discuss quickly. One is, I always like picking on articles like a soda pop in them, but we had a study that was done in soft drink intake in Japan and measuring the occurrence of heart disease, in this case ischemic heart disease, means low flow heart disease, stroke, and other different types of strokes in men and women. And what they found out is they had a study that included 40,000 Japanese men and women aged 40 to 59, and they had a questionnaire that was filled out over 1990 to 2008. And they were looking at how many cases of heart attacks were found in patients along with stroke, and with different types of strokes, including ischemic or hemorrhagic strokes. It means where you got a vessel that actually opens in your brain versus one that clogs up, ischemic stroke. And they did find that soft drink intake was associated in a positive way, which is unfortunate, with the risk of total stroke, and more specifically with ischemic strokes in women. That means blood flow compromised strokes in women. So again, if you're out there thinking about to stop drinking soda pop, again, another reason to stop drinking soda pop is to not increase your risk of having a stroke or other types of cardiovascular disease. Wean off of them, drink water, you'll be healthier all the same, much healthier. Okay, and then we've got a few minutes here to discuss an article that appeared in the December issue of the Annals of Allergy, Asthma, and Immunology. That's talking about your immune system. And it's looking at the widespread use of pesticides and also the widespread use of drinking chlorinated water. That means chlorine in your water, which is, of course, here in Anchorage and most major cities. And they were measuring the actual metabolites. What that means is when a person ingests anything, if you can measure its breakdown products through the urine, you can look at the metabolites. So what's it been broken down into? And so they looked at the urinary metabolites of certain chlorinated products and looked at certain immune globulins in the body that look at your allergy potential for being allergic. And measured as part of these great surveys that are done called National Health and Nutrition Examination Surveys, known as NHANES. This one came from 06-05. And, some of the big findings from this particular one is that they looked at a certain, metabolite, a breakdown product of chlorine in the urine, and also looked at different types of common pesticides that are broken down in the body into certain metabolites and measured that in the urine. And what they found out in the study is that they had many, of course, had levels of pesticides in all their urine. I mean, it's almost present in everybody. What they're looking for specifically, though, is if they had these metabolites in their urine, and did the individuals also show an increased risk of having an allergic potential, having an allergy-type potential in their body. And it looked at how sensitive they were to certain types of foods. And what they found out is that basically that this actually increases your chances of having allergies to food specifically, because you're ingesting these vegetables and fruits that have pesticides sprayed on them. They're being broken down in your gastrointestinal tract, and that's literally affecting the immune system of your GI tract, right? And I discussed here many times here on the show about the importance of gastrointestinal health being involved in the immune system. I just came back from a conference here 3 weeks ago now, that went over the same topic in a different form, saying, hey, listen, all these different types of foods that people are eating that are more processed are actually damaging the type of bacteria in the GI tract, and that, through a process not quite understood, to be honest with you, can increase your risk of developing diabetes. Diabetes and bad bacteria in your GI tract. Imagine that. And now we're talking about having food allergies because you're eating foods that are high in pesticides, in this case fruits and vegetables, that are going to damage long-term exposure to these things are in your GI tract, affect the bacteria, affecting the immune system, and increasing your potential to develop allergies, not just to food, I would also say environmental as well, things like pollen and cats and dogs and those sort of things. So it's amazing to think about that, because for the longest time I would say, well, pesticides get into us, and it's when they actually get into us or stored inside of us they're causing problems. No, it's not just being stored in our fat, it's how they actually affect that microbiome, that environment of bacteria in your gastrointestinal tract. It's fascinating. I mean, it is to me at least, and I hope it is to you to some degree. It's an encouragement to consider eating things that are lower in pesticides. With the amount of things we're exposed to in our environment overall, that means anywhere you sleep, live, and breathe, that means everywhere, it would be important to consider eating things that will have lower amounts of pesticides sprayed in them if you can't afford to buy organic. And I mentioned last week, again, I've mentioned this many times on the show, but the site environmentalworkinggroup.org or ewg.org, you can download for free off their site. They're basically a compilation that shows you fruits and vegetables that you can, if you can't buy organic, here are the least ones that are sprayed with the least amount of pesticides. And then you have the ones that are sprayed with the most, ones you want to avoid. And one of the biggest ones is the healthiest thing is an apple. Apples have the highest amount of pesticides sprayed in them than any other fruit and vegetable out there. Apples are the biggest one. And that's before, if you take the skin off, what would help? It will help some, but not all. Those pesticides are still getting into the pulp of that fruit in this case. So you definitely want to be eating apples organically. And yes, they cost more, but if you're trying to eat your food to support good health, then eat food that's low in pesticides, right? And again, ewg.org. Check it out. Good site for showing low levels of pesticides in fruits and vegetables and what ones to be consuming, what ones to not be consuming. That are the highest. And again, blueberries, I think, were number 4 or 5 on the list for high pesticide use. And I've consumed those for years, and now I only buy organic. They cost twice as much, but you know what? You're making better sense long-term for your health. All right, folks, that's the sign our show's about over here today. Reminders during the week, you'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Website address, drellenburg.com. Have a great week. Thanks for listening. We'll see you next Monday. Bye-bye.
A former bride and a former groom, a folding table and a folding chair, a folded hand, a poker there. All new directions must go everywhere. Big round people in a cool little square. Or you can't cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family. No melted ice cubes in a